Desiree go? Desiree Autenti is here, who is a nurse practitioner and benefited from the National Health Corps. We talked about that downstairs, and Desiree, I hope you will speak up in the course of this too, because you have a lot to offer. We appreciate you. We heard from Representative Katusian was acknowledged a minute ago, as was Secretary Bigby and Secretary Kerwin. I'm proud of you every day. Thank you for your contributions. So let us get started and involve everyone. And Madam Secretary, I turn it over to you. Thank you.
Thank you. Hello. Well, I am delighted to be here with my good friend Deval Patrick, the great governor of the Commonwealth of Massachusetts, and I had the wonderful opportunity and privilege of serving with him as governors together and stealing good ideas as he moved them along and lessons learned, and I look forward to continuing that partnership and taking good ideas from the great Commonwealth of Massachusetts, because certainly as we look at health reform nationally, it's very important to look at what has worked here on the ground. And so it's not accidental that 5 weeks into my term as secretary that I'm here to not only meet with providers, see some of your great hospital systems, and thank you again to Ellen to bring us here today. I caught just a brief glimpse of some of the amazing work going on in the neonatal unit upstairs, and a reminder of how incredible the technological advances are in this country that we have made, and how all Americans should have access to high quality care each and every day. So I'm delighted to be here to do that, and I was struck, Governor, by the fact that when Ellen spoke and said this hospital was founded in 1796, I was governor of a state that didn't come into the Union until 1861, so that sounds like a very long time ago. But my basic role here today is to learn from what has gone on in Massachusetts. Certainly the coalition that is represented by the panelists today is critical not only to come together to get a bill passed, but more importantly to implement health reform. And what President Obama is interested in doing, as your governor has been working on during his term here as the leader of the Commonwealth, is not just the legislative language, but the transformation of a health delivery system. And whether it's from the provider point of view, or what happens to patients and consumers, what the costs are being faced by businesses and families who are frankly not able to afford care any longer, not able to afford the kind of increases that we see year in and year out, and oftentimes not getting the high quality care that we know exists in some areas of the country, but not every place. So this is a huge challenge, but also I think a huge opportunity. I want to tell you that the president behind closed doors says just what he says outside in the public arena, which is that this is his #1 domestic priority. He is totally focused and intent on doing the work that needs to be done to get Congress to pass a bill this year, not sometime in his first term, but this year. He reinforced that. And so one of my missions is really to come and listen to the lessons you've learned and make sure that if there's some new generation approaches from what you've learned over the past couple of years, we can bring that best knowledge back to DC, back to inside the Beltway. There are people, and I'm sure the state representative may not be surprised to learn this, having been in partnership with the federal government. There are people who believe that all good ideas come from the Beltway in Washington, D.C., and many of them live inside that Capitol building somewhere. But I'm a believer that what really is happening all over this country is transformational, and what we have to do is make sure that those are the ideas and best practices and opportunities imported into the Beltway, and that that's what's used to drive and inform not only this legislative initiative, but more importantly, what we do afterwards, what the implementation of health reform actually looks like as it takes place across the country. So I'm delighted to be here. I'm delighted to have a chance to, first of all, thank the healthcare providers who are here for the work you do each and every day, making a difference in the lives of millions of people who probably don't say thank you often enough, but who are the beneficiaries of your great expertise, and again, to drive that so that all Americans have an opportunity. This is not about health insurance reform, it's about health reform and transforming what we're doing in this country in a very meaningful way, and having that resonance work its way through to consumers throughout America. So with that, I guess I would start off, as the guest who came from furthest away maybe to come here today, I get to ask the first question, and I would ask some of our panelists, as we work on the legislative initiative in D.C., what is it that you want to make sure we don't forget that you've learned from here in Massachusetts?
I'm holding the microphone. So I'll start. I'm here as a representative of the business community that was active in the discussions leading up to the '06 law, and I think what we found, we had a running head start, because Governor Patrick mentioned the free care pool that began in 1985, fiscal 86 here, and was a surcharge on hospital bills paid by the payers, of course, to put into the free care pool to take some of the burden for free care off the hospitals themselves. And over the years, since 86 to now, we found a way to share that burden with more than just the employer community. It's across the board, and I think that was the biggest thing that kept us at the table, was a desire to spend the money that we're putting into the system in a much better way. It was not an attempt to pay less into the system or to get money back from the system, but to find a way to have that money working well, more than just taking care of episodic free care, but to do something across the board that helped the system and those who were uninsured, and knowing they would get much broader and better coverage as insured rather than occasional visitors for free care. So the big thing to us was the sharing, was being part of a system that all of us understood, and I think one of the things that we've seen in the past 3 years is a much better awareness and understanding in the employer community too, but by employees and by all those associated with the system, that health care insurance is a benefit if you do have it, and that we have a much stronger relationship in working employers and employees to have cost management, to have wellness programs, to really get the most out of the system. It's not as much an entitlement or taken for granted as it was 10 and 15 years ago. We understand it now a lot better, all of us in the system, and the sharing is very important.
Dr. Herman? Thank you.
Pastor Hamilton.
Thank you. 3 quick things come to mind, Madam Secretary. First is comprehensive coverage for low-income individuals. Here in the state of Massachusetts, we cover just about everybody up to 300% of the poverty line. A brief story about that: there's a gentleman by the name of Peter Brooks, who is a member of Fourth Presbyterian Church, lives in South Boston. 2.5 years ago, he made about $16,000 annually, and he was a diabetic, still is a diabetic, of course, and he had to give himself insulin every day. And because he couldn't afford health care, he had to recycle his needles and his instruments to use to give himself insulins. Now, if you can imagine recycling your needles. Now, did I mention that he was Republican?
You just did.
I did, thank you. I mention that because sometimes in the national debate it appears that there are no Republicans who are in need of health care coverage, but he was and still is. Because of the reform in this state, today he has full comprehensive care, low deductibles, no deductibles, pay low premiums, and he just went in the hospital a few days ago, and one thing he doesn't have to worry about is his health care. So that's one thing that we would suggest, making sure that there's comprehensive coverage for low-income individuals. Secondly, there are about 51 community organizations in this state that was funded to help enroll people